In this video, we are going to discuss about the external features of the brainstem. This is the brainstem. Before going into the proper topic, let's see some general points regarding the brainstem. The brainstem is that part of the neural axis which extends rostrally from the cranial end of the spinal cord, which is over here, to the caudal part of the diencephalon, that is around this region, and it includes in succession the medulla oblongata, the pons and the midbrain. The brainstem subserves the highway of the ascending and descending pathways of the central nervous system. It contains the nuclei of the cranial nerves, reticular nuclei and other complex nuclear masses, and is concerned with a number of vital, somatic and visceral reflexes. Most of the brainstem lies in the infratentorial region of the cranial cavity. The cerebellum, that is this structure, it is connected to the brainstem by three pairs of peduncles, the cerebellar peduncles. The inferior cerebellar peduncles with the medulla, the middle cerebellar peduncle with the pons, and the superior cerebellar peduncles with the midbrain. The cerebellum, it is situated dorsal to medulla and the pons and separated from both structures by the cavity of the fourth ventricle. Let's see one by one. This is the anterior view of the brainstem. This much part will be the medulla oblongata, this much will be the pons, and this part will be the midbrain from the anterior view. First we will see about the medulla oblongata. The medulla oblongata is somewhat pyriform in shape, being wider at the rostral end and intervenes between the cranial end of the spinal cord and the pons. It measures about 3 cm in length, 2 cm in its widest breadth and 1.25 cm in thickness on an average. This is the posterior view of the brainstem with a part of the cerebellum removed to show its posterior aspect. For better understanding, let's see some general points. That is, this line, this structure is known as the stria medullaris, and the area below the stria medullaris will be medulla and above it will be the pons. So when we look at the medulla, it seems to have an upper open part and a lower closed part. The lower part of the medulla, that is the closed portion, it contains the central canal, and the upper part is, that is the open portion, it forms the caudal part of the floor of the fourth ventricle. The junction between the medulla and the spinal cord is represented by an imaginary horizontal plane which corresponds with the upper border of the atlas and cuts the middle of the odontoid process of the axis vertebra. The transition of internal structures between the spinal cord and the medulla is, however, gradual. The pontomedullary junction from the anterior aspect, it is represented by a horizontal sulcus which gives attachment bilaterally to the abducent nerve, the facial nerve and vestibulocochlear nerves from medial to lateral side. The facial nerve is attached by two roots, motor and sensory. The sensory root is otherwise known as nervus intermedius. Comparatively, the motor root is larger and lies on the medial side of the sensory root. The pontomedullary junction corresponds dorsally, that is posteriorly, with the medullary striae or striae medullaris, which extends horizontally across the floor of the fourth ventricle. This is the floor of the fourth ventricle, and the striae medullaris plunge into the substance of the medulla through the median sulcus. This is the median sulcus. The striae medullaris plunge into the substance of the medulla through this region. Let's see some more details about the external features of the medulla. So, better understanding, we will first see the fissures and sulci present on the surface of the medulla, and after that we will see how the substance of the medulla is divided by these fissures and sulci. Among the fissure and sulci, we can see the anterior median fissure, the posterior median sulcus, anterolateral sulcus, posterolateral sulcus. The medulla oblongata is incompletely divided into two symmetrical halves by an anterior median fissure and a posterior median sulcus. Each half is further subdivided into three areas, that is anterior, lateral and posterior, by the anterolateral and posterolateral sulci. The posterior median sulcus is a faint longitudinal groove and maintains a continuity with the corresponding sulcus of the spinal cord. Traced rostrally, it is continuous with the median sulcus of the floor of the fourth ventricle in the open part of the medulla. Each anterolateral sulcus, that is this sulcus, it intervenes between the anterior and lateral areas and gives attachment to the rootlets of the hypoglossal nerve, that is this nerve. It is in line with the attachments of the ventral roots of the spinal nerves in the spinal cord. Each posterolateral sulcus, that is the sulcus which is present posterior to the lateral area, it separates the lateral from the posterior areas and gives attachment craniocaudally to the rootlets of the 9th cranial nerve, that is the glossopharyngeal nerve, the 10th cranial nerve, that is the vagus nerve, and the 11th cranial nerve, that is the cranial part of the accessory nerve. This sulcus, it is in line with the attachments of the dorsal roots of the spinal nerves in the spinal cord. Therefore, the anterior, lateral and posterior areas of the lower medulla are continuous with the corresponding funiculi of the spinal cord. Now let's see how the substance of the medulla is divided. It is divided into three, that is the anterior area, the lateral area and the posterior area. First things first, that is the anterior area. This is the anterior area of the medulla. It intervenes between the anterior median fissure and the anterolateral sulcus. It presents a prominent bulging, the pyramid, which gradually flattens in its lower part. The abducent nerve, that is this nerve, it is attached to the brainstem between the lower border of the pons and the cranial end of the pyramid. The pyramid contains the corticospinal, the corticobulbar and a few corticopondent fibers. It is covered ventromedially, that is over this region, by the neurons of the arcuate nuclei. In the lower medulla, the majority of the corticospinal fibers decussate across the anterior median fissure, that is visible over this region, this shallow region, and after decussation this majority of the fibers proceed dorsolaterally and then caudally as the lateral corticospinal tract in the lateral funiculus of the spinal cord. The rest of the fibers extend caudally in the anterior funiculus of the spinal cord as the anterior corticospinal tract. The corticobulbar fibers or corticonuclear fibers establish connections with the motor nuclei of the cranial nerves, mostly on the contralateral side, and some terminate ipsilaterally. The third group of fibers, that is the corticopondent fibers, they make synaptic termination with the arcuate nuclei, and these arcuate nuclei are considered to be structurally and functionally homologous with the nuclei pondis. The efferents from both ipsilateral and contralateral arcuate nuclei. We have seen already that the arcuate nuclei lies on the ventromedial aspect of the pyramids, and the efferents from the arcuate nuclei assemble as the anterior external arcuate fibers, which is not shown in this diagram, and these fibers will wind around the anterior and lateral areas of the medulla and enter into the cerebellum through the inferior cerebellar peduncles. Next, we will see about the lateral areas of the medulla, that is over this region. The lateral area intervene between the anterolateral and posterolateral sulci. The upper part of each lateral area presents an oval elevation, the olive, which measures about 1.25 cm longitudinally. The inferior olivary nucleus lies beneath the olive. The two roots of the facial nerve are attached to the junction between the cranial end of the olive and the lower border of the pons. The lower part of the lateral area is continuous with the lateral funiculus of the spinal cord. For understanding the posterior area of the medulla, we have to look from the posterior aspect or dorsal aspect. Each posterior area of the medulla lies in between the posterolateral, that is over this, and the posteromedian sulci, that is, this is the posteromedian sulci. The posterior area may be divided into two zones, an inferolateral zone and a superomedial zone. The inferolateral zone, that is over here, it lies outside the floor of the fourth ventricle and consists of lower and upper parts. The fasciculus gracilis and the fasciculus cuneatus extend upward from the spinal cord into the lower part of the posterior area, retaining their respective positions, that is, the fasciculus gracilis medially and the fasciculus cuneatus laterally. The clava, that is the gracile tubercle, which is present over this region, it is an elevation at the cranial end of the fasciculus gracilis and is produced by the nucleus gracilis, into which the fibers of the fasciculus make synaptic relay. The fasciculus cuneatus ends in the nucleus cuneatus for synaptic relay beneath the cuneate tubercle. This is the cuneate tubercle, which is located somewhat rostrolateral to the clava. The gracile tubercle of both sides are connected by a V-shaped sheet of ependyma, which forms the lowest part of the roof of the fourth ventricle. The posterior area of lower medulla presents a low elevated area, which is over here, and it is known as the tuberculum cinereum, which intervenes between the fasciculus cuneatus and the posterolateral sulcus. Beneath the tuberculum lies the spinal nucleus and the spinal tract of the trigeminal nerve. This is a view of the brainstem from the posterolateral aspect to see one of the important structures, that is the restiform body, which is lying over this region. The upper part of the inferolateral zone of the posterior area is occupied by the inferior cerebellar peduncle, otherwise known as the restiform body, which diverges upward and laterally, forming the lateral boundary of the fourth ventricle. Thereafter, the fibers of each peduncle turn backwards to enter into the cerebellum. Dorsally, each peduncle is crossed transversely by the striae medullaris. The vestibulocochlear nerve, which we have seen already, it is attached to the junction between the inferior cerebellar peduncle and the pons. Before starting itself, we have said the posterior area have an inferolateral zone and a supromedial zone. We have seen the features of the inferolateral zone. Now let's see about the supromedial zone of the posterior area of the upper medulla, or otherwise the open part of the medulla. It forms the caudal part of the floor of the fourth ventricle. It is limited above by the medullary striae or striae medullaris and is divided into two symmetrical halves by the median sulcus, that is over this region. Each half is further subdivided by the sulcus limitance into a medial and a lateral area. The medial area presents in the lower part a triangular elevation or the hypoglossal trigone with its apex pointed below. Beneath the trigone lies the hypoglossal nucleus and the nucleus intercalatus. The lateral area is somewhat elevated and forms the vestibular area, which presents beneath it four groups of vestibular nuclei. In the lower part of the sulcus limitance presents a depression known as the inferior fovea, just caudal to the fovea, and in between the hypoglossal trigone and the vestibular area lies a vagal trigone, which contains beneath it the dorsal nucleus of the vagus nerve. The vagal trigone is further subdivided by an ependymal thickening, the funiculus separans, into a caudalmost inferolateral area known as the area postrema. The neurons of the latter act as chemoreceptors for vomiting reflex. The entire caudal part of the floor of the fourth ventricle below the striae medullaris is known as the calamus scriptorius because of the fancied resemblance of the pointed end of a writing pen. That was in general about the external features of the medulla oblongata. Now let's see about the pons. The pons or mittencephalon is about 2.5 cm long and extends from the cranial end of the medulla oblongata to the cerebral peduncles of the midbrain, that is over this region. This much region is the pons. Ventrally, it rests on the clivus, which is formed by the fusion of the basis sphenoid and basiocciput and is separated from the latter by the basilar artery and its branches and by the basilar venous plexus. Laterally, the middle cerebellar peduncles, that is these lateral structures, they connect the pons with the corresponding cerebellar hemisphere. Each superior cerebellar peduncle, for seeing that we have to go to the posterior aspect. Here it is. This is the superior cerebellar peduncles. So each superior cerebellar peduncle, it forms an elongated ridge along the dorsolateral aspect of the pons before it disappears into the tegmentum of the midbrain, just caudal to the inferior colliculus. This is the inferior colliculi of both sides. So the superior cerebellar peduncle enters into the midbrain at this region. The inferior cerebellar peduncle, that is over here, it's a cut section of the inferior cerebellar peduncle. They incline backwards before reaching the cerebellum in between the middle cerebellar peduncle laterally and the superior cerebellar peduncle rostromedially. On the dorsal side, the pons forms the rostral part of the floor of the fourth ventricle. Literally, the pons means a bridge, since it acts as a bridge between the midbrain and hindbrain and connects both the cerebellar hemispheres across the median plane. Now let's look into some more details about the external features of the pons. This is the ventral surface of the pons. The ventral surface of the pons is convex and presents in the middle a longitudinal sulcus basilaris or basilar sulcus for the lodgement of the basilar artery. Slightly above the middle of the pons, the ventral surface is continuous on each side with the middle cerebellar peduncles. Both the motor and sensory roots of the trigeminal nerve are attached to the pons at its junction with the middle cerebellar peduncle. The smaller motor root lies ventromedial to the larger sensory root. On close inspection, the ventral surface shows numerous faint transverse ridges and grooves, since this part is traversed by pontocerebellar fibers. The horizontal sulcus, which you have seen already in the medulla, which represents ventral demarcation of the pontomedullary junction, gives attachment bilaterally in mediolateral direction to the abducent, facial and vestibulocochlear nerves. Peripheral ends of the horizontal sulcus are known as the cerebellopontine angles, which are the meeting place of the medulla, the pons and the cerebellum. A space occupying lesion at the cerebellopontine angle may produce disturbance of hearing, equilibration and paralysis of the facial musculature. Now look at the pons from the dorsal aspect. The dorsal surface of the pons forms the upper part of the floor of the fourth ventricle rostral to the striae medullaris or medullary striae, and the elevation present just lateral to the medullary striae is known as the median eminence. Lateral to the median eminence, we have the continuation of the sulcus limitance we have seen already in the medulla. The sulcus limitance presents a depression over here, the superior fovea, in the widest part of the ventricular floor. At the level of the superior fovea, The medial eminence shows a rounded elevation, also known as the facial colliculus. It is produced by the underlying abducent nucleus and the internal genu of the motor fibers of facial nerve around the abducent nucleus. The vestibular area lateral to the sulcus limitance is occupied by the superior, lateral and medial vestibular nuclei. Traced rostrally, the sulcus limitance flattens to form the locus ceruleus, which is a bluish grey area composed of pigmented nerve cells known as the substantia ferruginea, and they are rich in noradrenaline. That was in general about the external features of pons. Now let's move on to the midbrain. The midbrain or the mesencephalon, that is anteriorly, this is the midbrain, part of the midbrain. It is the shortest segment of the brain, about 2 cm long, and retains somewhat primitive form of the central nervous system. This is a sagittal section, and in this section, this region is the midbrain. This is the anterior aspect and this is the posterior aspect. We can very well see that the midbrain contains the cerebral aqueduct or aqueduct of Sylvius. It is surrounded by the central gray matter and communicates the third ventricle with the fourth ventricle. The midbrain extends ventrorostrally through the tentorial notch from the pons to the diencephalon. It is composed of a pair of cerebral peduncles in the front. In the posterior aspect, the corpora quadrigemina. Each peduncle is further subdivided ventrodorsally into the crus cerebri, the tegmentum and the tectum over the posterior aspect of the cerebral aqueduct. From the anterior view, this is the crus cerebri. Now let's see into the details of the external features of the midbrain. The ventral surface of the midbrain presents the crura cerebri or the crus cerebri, which diverge from the cranial border of the pons to the under surface of the cerebral hemispheres. It forms the posterolateral boundary of the interpeduncular fossa. This is the interpeduncular fossa and crus cerebri forms its posterolateral boundary. The superficial surface of the crus cerebri is finely corrugated by the longitudinal fibers. The surface of the crus is crossed transversely from above downwards by the optic tract, the basal vein, posterior cerebral artery and superior cerebellar arteries. The vascular structures are not shown in this diagram. Between the posterior cerebral and superior cerebellar arteries intervene the oculomotor and trochlear nerves. The oculomotor nerve emerges from the medial side of the crus cerebri, while the trochlear nerve emerges from the lateral side of the crus cerebri. Laterally, the midbrain is overlapped on each side by the parahippocampal gyrus, and in the interval between the cerebral peduncle and the temporal lobe, the trochlear nerve passes ventrally. Dorsal to the crus cerebri, the lateral surface of the peduncle presents a lateral sulcus, and beneath the latter, the lateral lemniscus is located. It is not shown in this diagram. This is the posterior view, and here is the midbrain from the posterior aspect. On the dorsal surface, the tectum of the midbrain consists of four rounded elevations: the superior colliculi and the inferior colliculi. The colliculi are separated from one another by a cruciform sulcus. Traced above, the vertical limb of the sulcus forms a surface depression for the lodgement of the pineal body. The vertical limb is continuous below with the frenulum veli. This is the frenulum veli, and it is a median ridge on the dorsal surface of the superior medullary velum. This is a part of the superior medullary velum is shown over here. Rest of it is removed to show the posterior aspect of brainstem. So the frenulum veli lies over this region. On each side of the medullary velum, superior medullary velum, the superior cerebellar peduncles can be seen, which we have seen already. Trochlear nerves, after decussation in the superior medullary velum, they emerge contralaterally by the sides of the frenulum veli, and they cross the dorsal surface of the superior cerebellar peduncles, and they then turn ventrally lateral to the cerebellar peduncles, which is located over here. They cross lateral to the cerebellar peduncles. Now, for better understanding, we will look from the posterolateral aspect of the brainstem. Each superior colliculus acts as a subcortical center for visual reflexes. They are connected to the lateral geniculate body of the thalamus by a raised band known as the superior brachium, and this superior brachium lies between the pulvinar of the thalamus and the medial geniculate body of the thalamus. Each inferior colliculus acts as a subcortical center for auditory reflexes and is connected to the medial geniculate body of the thalamus by another elevated band known as the inferior brachium. So, these were the important general outline of the external features of midbrain. We will see the internal features of brainstem at each level in the coming videos. Thank you for your patient listening.